Welcome to Forward with NACCE, Inspiring Entrepreneurial Action, a podcast that shares the stories of everyday entrepreneurs, entrepreneurial leaders, and the communities that support us. We hope that this diverse collection of stories brings you inspiration, inspires you to take action, and ignites entrepreneurship in your community as we make our way forward together.
Welcome to this special edition of Forward with NACCE. We are very happy to have a special guest here from Raleigh, North Carolina, where our headquarters are located today. And before we get started, I just want to thank my colleague, Natalia Berezhna, for her exceptional work on building this podcast, getting a following around the world, and just her warmth and professionalism. So she is going on to amazing things, as our listeners will no doubt not be surprised, but her heart will always be with NACCE. So thank you, Natalia, for all of your work over the last year. And with that, I'm delighted to welcome Dr. Alan Mask to the program. He's got a really interesting background in being on TV as a medical expert and as an entrepreneur. So we're going to jump right in here. And Dr. Mask, please share with us a little bit about your background. How did you get to the point in life where you are? And then we're going to talk a little bit more about the work that you do.
Dr. Corbin, thank you for having me today. I grew up in a small railroad town about an hour and a half from here called Hamlet, North Carolina. It was a segregated community. You know, we weren't allowed in the local restaurants and movie theaters and so forth, but we still had a very strong Black community. Our PTAs, our schools, our churches, we had our own seamstress, people who did our dry cleaning, et cetera. So it was really a very wholesome environment. My dad was a school principal. I was a music teacher, so I grew up in an education family. My biggest inspiration for medicine, though, came from my uncle George Mask, who finished St. Augustine's College in Raleigh back in the late 1940s and went to medical school in Zurich, Switzerland, of all places. He decided that he wanted to become a doctor. There were very few opportunities for him in the United States, and so he actually caught a long boat to Europe, was in Freiburg, Germany for his initial training, but eventually took his degree in Zurich, Switzerland, came back to New York, actually, did his internship and residency 1958 to 1962 when I was a small kid. And of course, I remember him in his white coat and his inspirations that he would share with me. And that was the beginning of my career. It led me to do pre-med at UNC, to do medical school at UNC. I did my internship and residency at Massachusetts General Hospital and Harvard Medical School, and then came back to find my fortunes in North Carolina.
Wow, we are so lucky to have you in this state. And I believe you became connected to us through a colleague, Katie Gales, who has recently joined NACCE full-time as our Senior Director of Membership and Diversity, Equity, Inclusion, and Belonging. Very long title, but very, very important mission. And it strikes me that, you know, you really honor the past. I mean, the past has had a lot of difficult challenges, you know, for people, you know, particularly people of color. And I see that you really have found education to be the door open, but not everybody who goes into medical practice or education becomes as entrepreneurial as you are. So maybe you could tell us a little bit about how you sort of began acting as an entrepreneur, even if maybe you didn't recognize yourself in that way, maybe some of the early experiences that you had.
Well, when I returned to North Carolina, I actually did a second residency in anesthesiology. I left to go work for Burlington Anesthesia Associates in Burlington, North Carolina. Then I did a lot of emergency room work at the Cape Fear Valley Hospital in Fayetteville, North Carolina. And that's when I became interested in emergency and then became also involved with urgent care. We were one of the first urgent care centers, in fact, in the entire country. The docs that I worked with and the PAs there started the concept of Doctors Urgent Care Center back then. I worked with them as well as working in the emergency room, and subsequently opened my own office in Raleigh, North Carolina in 1985. And it was a paradigm shift. It was really to the medical community in Raleigh and across the country, because the idea that you could go someplace other than an emergency room and someplace other than a doctor's office that typically required an appointment for acute problems like lacerations or nosebleeds, headaches, and so forth. We became quite busy right out of the box. The doctors in the community weren't quite sure how to accept us. They really had not known very much about urgent care. When would make referrals, they weren't sure who this doc was coming from an urgent care center with a patient with acute appendicitis, for example. The hospitals would joke and call us doc in the boxes, much like a McDonald's fast food. But they came around. It was in 1998 that I took my daughter to Harvard as an undergraduate. She was staying in Apley House. And as I was unloading the car, I looked right across the street and I saw Harvard Urgent Care. We had arrived. So again, we had a 13-year lead. The hospitals didn't really become involved with urgent care until much later. And, in that sense, we were entrepreneurs. We also helped to spawn the age of PAs as well. Of course, we assistants now in gynecology practices, orthopedic practices, et cetera, but they weren't really that well accepted back then. The whole concept of PA started, as you may know, at Duke University back in the 1960s. That Dr. Harvey Estes had the idea of taking the Army medics that had come from the war and saying, well, gosh, they aren't nurses, they aren't doctors. How can we utilize them? And so there evolved the 27-month PA program. Of course, we used PAs back then, and of course, they're ubiquitous now. We certainly appreciate that.
So it sounds like, really being cutting edge, seeing an opportunity, seeing a need. I know I've known people too that feel a lot more comfortable walking into an urgent care because they may think I'm not like at death's door. I don't need to be in an emergency room. And, so it sort of fills a need, which is what we see entrepreneurs do. But 13 years, that is a long time, to kind of keep at it. So how did you go about doing that? So people who might be listening to us may have an idea and they're trying to communicate it out to people. What were some of the things that you did to really convey to the public that this was something worth investing in and this was really sort of cutting edge for the future? How did you go about that?
Well, the difference I think that we made was we really cared about patients, and all doctors and PAs and nurses, we all care about our patients, of course, but we were very careful to learn patients' names. We were very careful not to call people by their first name. It was Mrs. Jones or Mr. David. We were very careful to be respectful of people's time. So they came into the waiting room, even though it was a no appointment basis, had to wait more than 15 or 20 minutes. We were quick to say, gosh, we're sorry. We apologize for the wait. We want you to know that we really care and respect your time as well. We practice good medicine. We had very well-credentialed people working in our offices as well. But one thing we did, Dr. Corbin, that even today stands out differently from what other practices are doing, we did what's called callbacks. We called every single patient we saw the next day to find out how you're doing. It was good for us because it improved the quality of care that we provided. Patients were stunned that we would take the time to call, that I'm on the phone as well. It also minimized any sort of medical legal problems we had, because if there was anything that we possibly had missed, we had an opportunity to catch up on it as well. And so I would say for the entrepreneurs who are watching, just to have passion for what you're doing. And nothing goes better than good community service, good customer service, whether you're going to a restaurant, whether you're going to buy a suit of clothing, whether you're going to the dentist or to the medical office. As I would say around patients for years, patients can go anywhere to get penicillin. There are lots of patients, lots of places patients can go to get a shot of penicillin, but the kind of mail provide here, the atmosphere, I think, is what's going to keep people coming back. And it allowed us to have a good, long career at that location on Rupert Avenue.
Yeah, what I hear you saying is you're really looking at the patient, right, as your customer. And I think that's what we're seeing a lot in higher ed is looking at the student as the customer. And I know Duke is a wonderful system. One of my children was actually treated there years ago for leukemia, and they pushed through an actually experimental approach so that he wouldn't have to have as much medicine as another baby. And ultimately it saved his life. And I just, back then I think about it, in terms of being a parent in a situation like that. And I think of the kindness that was extended to us, similar to what you do to your patients. And I think often that helps people reach out and get help. So one thing I'd love to talk to you about is, as we all know through the pandemic and some of the research, so many people are struggling with mental health issues. There doesn't seem to be enough help out there for people to get it. There's some online opportunities. We don't know how good those are. Can you share with us maybe some insight as a doctor, a medical doctor, but also in your practice? And I want to talk a little bit more about your urgent care. Folks that are struggling with issues like that, is an urgent care a place where they can go and get a referral or get some help, or what would you suggest?
Oh, absolutely. I think that's an ideal place to go because you can go without an appointment. And in most situations, I think you're going to get excellent care there. Patients will present to an urgent care center with novel problems. It may be a child who has a gait disturbance. It may be a person who has strabismus or cross eyes or whatever. It may be a scenario where we can't help them, but we certainly know all the good practitioners in town, and oftentimes it's a matter of simply connecting them with that. We don't do a great job with the mental health piece. We've been struggling with that for decades now, and this pandemic has been a big reminder of that. But I think telehealth services, for example, have expanded. I think that's where the big shift is right now. More and more of the cases we're going to take care of will be in the modem that we're in right now. And I think that we just have to used to that. I think it has some limitations. I think it's good for mental health in terms of counseling and so forth. I think you can have a licensed therapist who sees a patient. Then you have these scenarios now where there are relationships between the counselors as well as with psychiatrists and licensed physicians and so forth. So patients can get the benefit of counseling as well as get the benefits of medication as well. That really has exploded now. In terms of care, the patients like it because they can usually you're on time for that. If you've got like we started today at an exact time, that appointment is typically
That's right.
that time. It's an efficient visit. You don't have to get dressed up to go or worry about parking and so forth. And typically the feedback systems are really good right now with the My Chart scenarios where patients can get their lab results back very quickly. And the thing that we always enjoyed in my practice was really, choosing referrals that we would choose for our own families. So if you need to have a knee replacement, I know where I'd go for a knee replacement. Have cataract surgery, I know where I would go for cataract surgery. And so instead of people sort of wandering out there, we made it our business for many, many years to provide those services. And you've got to be your own best advocate. You've got to ask questions. You've got to get educated. And you've got to be aggressive for yourself and for your family. I think that's still a big part of having good health care.
Yeah, and it sounds like with the kind of operation that you run as a parent, or maybe some of us who have to be advocates for our parents who are, getting up there in age and having some health issues. If you have sort of that partnership with a medical provider institution, you're kind of on the same side, right? It's not doesn't need to be, adversarial. Sometimes they can help you on the insurance end and all of that. So why don't you talk to us a little bit about what it's like for you running the practice? So you're trained as a medical doctor and obviously care very much about patients. What kind of a role do you have with the urgent care? Do you have people doing the business side for you, or are you in partnership with them? Just tell us a little, because most people don't think of medical providers as also being business people, but it sounds like you might do a little bit of both.
Well, I see myself as an expert because we've been at this now about 35 years. Quite frankly, I'm semi-retired right now. I'm mostly doing just telehealth cases. I'm still doing some occasional television work. I'm working as the physician for the city of Raleigh. There's a big partnership, I would say, among a lot of people in the medical office. You've got the people who run the front desk who are responsible for greeting patients, people who are responsible for collecting co-pays and filing insurance and so forth. They're a very important part of our practice. We have our nurses and our lab techs and our x-ray techs who are responsible for bringing patients back. Their general medical assistants, and in addition to being lab techs, if you will, or x-ray techs who then welcome the patients. And that's a big part of who we are. As I tell on a local bank board, and I tell the bankers, I said, the most important person in your operation is your teller, the person who's interacting with the person and creating a sense of warmth. You can sit in these ivory towers and make all these big decisions about interest rates and so forth. But what's going to drive your growing and providing good services is having a good relationship with the people and respecting the people who are doing the basic services. And, it's like the old IBM mantra, respect for the individual. And I'm telling you, for anybody who's about to start a business, you just can't forget that piece of it. And even, we say the customer's always right. Well, sometimes we know the customer's not always right, but you really have to work towards that objective. That's got to be the space that you operate in. And we have made a tremendous living. We've had a very successful practice. The television work has been just a dream come true. The opportunities I've had there, the people I've interviewed, the places I've traveled, the privileges I've been able to enjoy, and it's been a good run for us.
Well, you sound like you have a very grateful heart too. That really comes through in what you're saying. And, it occurs to me here on our program, we have a lot of listeners, obviously around the world, but we have a good following in North Carolina, Cary, Raleigh, Apex, and so forth. And a number of people, like my own family, who moved down here in the last couple of years. So you're kind of starting from scratch, right? You've got to, make those medical connections. How might people find out more about your practice and some of not only urgent care, but some of those resources that they may be in a situation where they're trying to identify people that, as Wendy Coulter says, they know, like, and trust, so they become, referred in a way that you would do that for your own family. So could you share with us maybe a website or some resources where people could look?
For medical information, the website that I like is cdc.org, or cdc.gov, which is a site that I depend on for a lot of medical information. I think if you're looking for individual practitioners, a good way to start really is to talk to family and friends. Talk to people who've actually been to a particular medical practice to find out exactly what the services were like. Are the people attentive? Are they friendly? Are they prompt in terms of the services they provide? And make your decisions that way. You can also call the medical board, North Carolina Medical Board, for recommendations. You can make calls to the North Carolina Medical Society and, of course, get information that way. Even though we're doing just telehealth now, we still have our phone numbers connected, 919-231-3131. And I get calls every day for patients that I'm not able to see from a telehealth perspective. Then, of course, I'm willing to make recommendations as well. There are a lot of good practitioners in that area. We have the benefit of Duke, we've got Wake Med, we've got Rex, we've got UNC. We have so many wonderful medical facilities in that area. This is one reason we're really blessed to live here. We think about the weather, we think about the people, we think about the terrain, but also medical care, particularly as we are dealing with younger children, as we get older and so forth. We want to make sure to have that. We have a great 911 system. The paramedics and EMTs, they are just not thanked enough for what they do. Getting you, I call them at my office and they're there in like 3 minutes or whatever. And they do this on a consistent basis. They're in and out in a matter of a few minutes. And also I want to give a shout out to the nurses. The nurses are really the backbone of our medical care system. They don't get enough thanks for what they do. They toil, they're very, very smart. And of course, their role is expanding with nurse anesthetists, with nurse practitioners, et cetera.
Yeah, I think that is just so important. And there are so many resources here. And some of the, as you know, across the country, not all communities are blessed to have that, but they do have dedicated men and women that serve in a variety of roles. And I think what you are suggesting is that people be advocates for themselves and for others in their family, and really, go that extra mile to find out, talk to people about what their experiences are. Some of what we're seeing, and hearing through the news and so forth is, coming out on the other side of the pandemic, people may not have gotten regular checks and maybe done some of the things. Maybe they got into some bad eating habits, no judgment, but, people kind of joke about it. But you see how with the gyms shutting down and things like that, some people stress eat. What would you suggest to people now that, we're not done with the pandemic, but we're kind of coming out on the other side? Do you have a couple of suggestions and it could be entrepreneurs who are listening that maybe want to take some more positive steps for their own health? What might they do that aren't heavy lifts, but little things that maybe would make a big difference in their lives?
Sure. Dr. Corbin, I met Dr. David Satcher, the former U.S. Surgeon General, some years ago, and he said the most important thing that we can do for our health is self-intervention, that there's so many things that we are empowered with that we can do to make a big difference. And he talked about 5 quick things. Number 1, exercise 30 minutes at a time, 5 days a week. Exercise reduces your blood pressure, reduces your cholesterol, strengthens your bones, reduces your blood sugar, helps you to lose weight, helps clear your mind. It's good for osteoarthritis, for congestive heart failure. Make sure that we're simply taking the time to exercise about 30 minutes at a time, 5 days a week, whatever that means. Number 2, eat 5 servings of fresh fruits and vegetables every day. And remember to eat mostly a plant-based diet. Try to cut back on the red meat in your diet. For example, there is a correlation between excessive red meat intake and colon cancer. Number 3, practice responsible sex. Number 4, avoid alcohol and tobacco. Those are toxins, and 55% of all hospitalizations are either directly or indirectly related to alcohol consumption. There's increased risk of breast cancer from alcohol consumption. And of course, tobacco leads to all sorts of cancers: mouth cancer, throat cancer, lung cancer, bladder cancer, prostate cancer, etc. So you want to avoid tobacco for sure. And finally, Dr. Satcher talked about practicing some stress reduction activity every day. Particularly, as you pointed out earlier, we're under so much stress in this pandemic, but yoga, transcendental meditation, prayer, exercise, we've got to think about our mental and our spiritual health as well. And those are some things that we can do. And for the entrepreneurs, there's space in all those areas for you to be involved. For example, working as a personal trainer, working as a nutritionist. I'm a big fan of registered dietitians and so forth, who can help us so much with our diet. People who might be interested in acupuncture, people might be interested in teaching yoga, people may be interested in teaching transcendental meditation, people in smoking cessation programs, alcohol cessation programs. There's a lot of space there for entrepreneurs if they're looking to do some good. And I think there's some opportunity if you really think about it, write up a business plan, think about what you have to offer, get it out there. I mean, really talk to a lot of people, do some marketing and so forth. I think there are a lot of opportunities that are available right now.
Yeah, there's just so many excellent things that you said, and I hope people really absorb those. And if you can even start with a few of them, I did that myself. Actually, I was trying to eat less meat, so I knew I couldn't become a vegetarian and stick with it, but just eat red meat instead of eating it maybe 3 or 4 times a week. Maybe stick to 1 time a week, or start with where you are with what you have. The other thing that we do here at NACCE is really leverage opportunities through community colleges. We have a wonderful system of community colleges. So people may actually have a medical degree. You might be a nurse or a doctor, or have some other type of profession, but you've always had a business that you may want to start. Like you had mentioned many good examples. A great place to go is to a Wake Tech or a Durham Tech or another institution, even the universities. We have some wonderful HBCUs that offer courses. And I think to that end, I think tying a bow on all of the wonderful suggestions that you had is really be connected to other people. And I know a lot of people that I've talked to, and sometimes I look in the mirror and I talk to myself. It's easy to feel disconnected from other people. But like you said, some of the wisdom that you shared with us in this brief conversation is, don't just advocate for others, advocate for yourself, take care of yourself, make sure that you do those things that are going to make you a healthier, better person. It makes you a better citizen. It makes you a better family member. So I'm really excited to have you on the program today. You have so much background we haven't even gotten into. You've been on TV and there's just so many good things, but I would love it, Doctor, if you could just end our conversation about sharing something that you're hopeful for in the future, maybe something that you've learned throughout your life or even through the last couple of years of the pandemic that gives you hope and optimism.
Well, there are a lot of beautiful people in this world, and we need to emphasize peace. We need to emphasize sharing. We need to emphasize doing for one another. gifts during the holidays. If you really stop to think about it, it's really much more fulfilling to give than it is to receive. I think about during the holidays when I get gifts from my kids, and I'm so appreciative of that. But I really appreciate even more the feeling I have when I'm able to give. And sometimes you just have to take a pause and just do whatever you can do to be able to help somebody out. It may be that you go grocery shopping for someone. It may be that you go and cut somebody's grass. It may be that you're willing to pick up somebody's kids in the afternoon. It's about making financial contributions to good causes. And my mother was always a big proponent for that. I'll tell you a quick story. We did a TV piece once about a person whose house had burned down. And my mom wanted the name of the reporter. I said, "What do you want that for?" So I got a call her, and her idea was that she wanted to try to get the address of the person whose house had burned down. I said, "Look, if everybody would send $25, and I'm going to do that, I'm going to find out who this person is, I'm going to send it, then what a big difference you could make." So it's all about giving back and truly giving back. We're all been blessed with so many opportunities. And let me congratulate the people of your system, Wake Tech, Durham Tech. I'm the biggest fan, not only for the degree programs, and for the kids, young people who go there, who then transfer to higher education beyond that, but also for your individual programs where people can go for self-help. They can broaden their skills in specific areas with weekend courses, with nighttime courses as well. You're a very, very big part of what we are doing to be a great state of North Carolina.
That is beautiful and well said. And I think too, just thinking about the Wake Techs, Durham Techs, and so forth around the country, that is a career ladder. And that was my experience I was sharing with you at Duke, is that one of the wonderful oncologists had actually started her career as a nurse and had 4 children. So it took her a long time, but she eventually went back to medical school and had this passion for helping other people. So I think that comes through, and I think it's exciting. And I think that giving, there's no question, every time you give, you get so much more in return. So I hope people will follow your example and embrace a more healthy lifestyle. We can all do better at that, give to others, and, make the world a better place. So I thank you so much. And my final word too, as we're recording this at the end of February, to just great pride and support to come through for the Ukrainian people. Many of you may know our producer, Natalia, is Ukrainian and is probably one of the kindest person that I have ever met. And I know it's a difficult, very challenging time in the world. And I think those who are trying to make their way forward and give back to others offers, the greatest hope. And we see a lot of stories of courage. So thank you so much, and just wish you all and all of our listeners a wonderful day.
Thank you, Dr. Corbin. I appreciate the opportunity to be with you today.
Thank you for joining us today. We hope that you will continue to explore the many ways to define entrepreneurship with NACCE as we celebrate opportunity, failing forward, and success, learning from one another along the way. Subscribe to this podcast on your favorite platform and follow at NACCE on social media, and learn more about us at nacce.com/podcast. Stay tuned for a new episode each week. We look forward to making our way forward together with you. Have you heard about our latest book, Impact Ed: How Community College Entrepreneurship Creates Equity and Prosperity? This is our roadmap for building back better in 50 states and globally. In each chapter, we share the inspiring stories of everyday entrepreneurs and explain how community colleges play a crucial role in their success. Visit us at nacce.com/impacted to order your copy now and join us in this work.
Are you curious about what's coming up next in the NACCE community? Join us on the second Wednesday of every month at 12 p.m. Eastern to set yourself up to be productive and impactful with NACCE by your side. We'll share about events, ways to get involved, and we'll have an open conversation featuring questions you're asking or problems you're facing. So join us on the second Wednesday at 12 p.m. Eastern for Up Next with NACCE. More information at nacce.com/upnext.